Welcome everyone once more. Welcome to the Chicago Cancer Health Equity Collaborative. ChicagoCHEC is a collaborative, a cancer health collaborative with Northwestern University, Northeastern Illinois University, and University of Illinois at Chicago. Our ChicagoCHEC Seminar Series today is on research dissemination. Just wanted to inform everyone of our virtual community forum, which is on addressing cancer together during COVID-19. It will be on September 17th and 18th at 11 a.m. to 1 p.m. on both days. Registration and Zoom details can be found on our website, Facebook, and Twitter pages. And here are some topics that we'll be discussing throughout the virtual forum. And my name is Ifeanyi Beverly Chukwudozie. I'm a site program director for ChicagoCHEC at the University of Illinois at Chicago. Once more, today's webinar will be on research dissemination, and we have the pleasure of having Dr. Christy Holmes to present on this topic. Dr. Holmes is the director of the Galter Health Science Library and Learning Center. She's a professor of preventive medicine and medical education, and also the associate director for evaluation in the Northwestern University Clinical and Translational Science Institute, NUCATS, all at Northwestern University. Welcome, Dr. Christy Holmes, and I will stop sharing so that Dr. Christy Holmes can share her slides. And as she's bringing up her slides, everyone is currently on mute. We will have, after the Dr. Holmes' presentation, we will have question and answer sessions. Feel free to, while she's presenting, to type your questions in the Q&A session at the bottom. And after her presentation, everyone will be unmuted and we'll respond to questions that were typed in the Q&A session, and everyone can also give or ask your questions. Thank you so much. Welcome. Thank you, Dr. Holmes.
Okay, thank you very much. Do my slides look like they're in the right orientation?
Yes.
Okay, wonderful. So thank you. It is such a pleasure to be here today, and especially to be here to chat with you all and the ChicagoCHEC community about research dissemination. I have the great pleasure of being a teammate on the ChicagoCHEC grant. I work on the planning and evaluation core with my colleagues from the 3 different institutions, and it's just a really wonderful group, and like I said, it's a real honor to be here today. So today we're going to talk a little bit about this idea of dissemination. And I think as we think about the research process and what research means, you know, we can have these very traditional ideas about research. And we can see some of these stages that are outlined here. This is actually in a paper that just came out a couple of months ago, where we can see the different stages of research that move from having an idea all the way out to dissemination. We can understand why that process is important and some of the different things that happen during each one of these phases, as well as specific concepts or specific things or metrics that you can examine in each one of these stages in order to understand how the research is going, is it having its intended effect, and so on. So, you know, so this is really, I think dissemination is a very important part of that, because we're really looking at making sure that the research that we do, our findings, our knowledge, anything that we create, that we're able to get it to the people who can use it, or who might be able to build on those ideas and have new and different perspectives to share with us all. So a couple of definitions just to get us started. First off, dissemination. When I use the word dissemination, I'm talking about making research discoverable and accessible to various audiences. And we'll talk a little bit about the audiences here in a few minutes. And then this word impact is so big. It could mean nearly anything, right? You know, it kind of depends on the audience. But what we're really looking at is demonstrating the outcomes of research in academia, society, and beyond. And we could spend all afternoon talking about this, but I'm just going to touch on it a little bit today. So to put things in context, it might be helpful to take a moment for a trip back in time to think a little bit about how dissemination has worked over the years. So in early times, you know, here we're going all the way back to 1665, we see that knowledge is transferred between people through actual letters, right? That eventually became the peer-reviewed journals that we see today. And that's still a very important part of how we're disseminating our research out to our colleagues, to the scientific community, and also to the public as well. You know, here we are hundreds of years after the invention of the printing press, and we have thousands and thousands of journals. And there are some different approaches that these different journals take in terms of communicating the information that is published within. There are some relatively new journals that I personally think are very exciting. We have journals such as Faculty of 1000 Research, PeerJ, and eLife. These particular journals are new. They're making a big splash, and they're experimenting with new forms of peer review, making that process much more open, new business models, more acceptance of preliminary publication of results, and new funding sources. So we talked a little bit about disseminate and impact, but I do want to point out a couple of other concepts here. One is diffusion. So dissemination implies this very kind of active process, but diffusion is passive. It's informal, it's unplanned, it's where information spreads to various audiences without a deliberate, proactive action taking place. And then engagement is meaningful involvement or exchange between individuals who are involved in research, as well as people who are consuming that research, who's interested, you know, who's giving feedback. So moving on to dissemination. Why dissemination? It's very important actually for us to get the work that we do out to the communities and the audiences who can make use of it. There are a few practical reasons why we do dissemination. So we can show that we're making contributions to science and better understand what those contributions are. You know, for some of us, especially for folks who are working in the university setting, citations and the indication that people are building on your work and incorporating it into their own work is a very important part of recognition of your impact in a field, and can also help your process of promotion or recognition locally. And then it's just a way to attract attention. So getting that spotlight on research fundings can be a nice thing for the funders to see, or for supervisors and more. So those are the practical reasons, but there are also some theoretical or philosophical perspectives that we can incorporate as well. We want to advance knowledge and advance the understanding of our audiences in the kind of work that we're doing. We want to be able to interact and to be able to directly discuss and debate knowledge. I think many of us who are involved with research would like to increase positive attitudes about new knowledge or discoveries. We can create gains in competence in terms of better understanding of a particular topic area, and then also increasing usage of resources or of knowledge or discoveries. Another important part of this, in addition to the practical and the philosophical, is actually the funder. So a lot of the work that we're doing in research is funded by an actual funder or a funding organization. And so here are some quotes from some funders about how they feel about dissemination. And so they're actually asking for this to be part of the materials that are submitted when a researcher applies for extramural funding or outside funding. So they're asking that there must be a plan for collection and dissemination of useful products of research, including approaches, technologies, and tools that are relevant to the research and the user communities. That's so much more than the publication, just that one peer-reviewed paper. We're talking about all sorts of different things that are created through the research process. And we're going to talk a little bit more about that as we move on. So one of the best suggestions that I can make is to make a plan for dissemination. So what does a dissemination plan actually mean? So certain plans may have some common characteristics, such as what research findings or products are intended for dissemination, the what do you want to achieve, who is your target audience, what tool, resource, or format do you want to use to get that news out? And then, do you actually have content in hand? Have you written, or are there little snippets of text that you can use, or do you actually have to generate it, which can take time? And so there are a number of really wonderful plans and tools that you can use to help to guide your own work here, which I've outlined here. And there are many others. This isn't an exhaustive list. But if you're an individual, you may just simply make a bullet point list of the things that you and your colleagues can do to disseminate the work to the end user. And so this is one particular researcher's list of things to do related to the dissemination of a peer-reviewed paper. Write a blog, tweet about it on Twitter, post it on Facebook. So you can see there are a number of different things that you can do, and it really does reflect an individual's specific topic area that they're researching as to what they might choose to do. So I mentioned earlier that we're going to talk a little bit about choosing an audience. I actually think this is a really important part of this. So we're going to spend a little bit of time on this. We want to understand who our target audience is. We can do that by incorporating this idea of a persona. So the persona is this concept of a particular role. So they can represent a major user group. As we think about this particular user group or these different user groups, we can put our, put ourselves in their shoes, think about their needs and their expectations, some of their challenges, and that can all help to inform how we approach dissemination. But it's important to recognize, even though these personas are kind of a composite view of these particular user groups, they actually represent real people. And so we want to think about this in a really thoughtful and respectful way as we are developing our dissemination strategy. Here's a wonderful quote from this book, Using Personas as an Intermediate Construct in the Development of a Tailored Message, a case study. They say, tailoring health education messages to patients' characteristics has been shown to enhance the intention to adopt or change particular health behaviors. And I would argue that that's because the message is actually much more relevant when it's put into the context of the user. So let's take a look here. We've got a couple of examples here. And just to share a little bit of information as we get started, the choice of a specific method, like a strategy for dissemination or channel of communication, largely depends on the characteristics of that targeted user. So for instance, if we're talking about basic science researchers, those folks that are in the lab, usually they tend to be located in academic institutions or research institutions that tend to value peer-reviewed research, publications, and scientific conferences, which can help us think a little bit about how we can reach those folks. Providers, healthcare providers and administrators aren't typically as deep into the peer-reviewed literature as researchers. Generally speaking, this isn't, of course, the case always. But early studies demonstrated that clinical psychologists, for example, only read about 2 to 4 research articles per month. Rather than reading journal articles, they tend to seek out new information presented in interactive formats. This can include conferences or presentations, articles mentioned in the popular press, television, or exchange of information with other providers about, how that innovation is actually being used in practice, like that firsthand account. Lay dissemination research has indicated that most individuals, including older adults in their families, are more likely to pay attention to information disseminated to them by those in positions of trust or authority and who they find credible, or from near peers. So for instance, their colleagues and friends, as well as information in a medium that's easy to read. So pamphlets, bulletins, sometimes websites, and many consumers and family members are not actually comfortable with electronic media. And so that's something that you also want to keep in mind, and it's important to keep to be considerate of the way that individuals may be interacting with information resources, and how can you make this as easy as possible? What are their preferred communication streams? So here, as we look at the basic science researchers, we can see some of their interests and concerns. They're interested in managing goals. They want to stay up in the research field. That's why they are, tending to go to the peer-reviewed literature. Specific considerations, they tend to use technology for work and personal life, and their knowledge may be hyper-focused to a specific area or field. If we're looking at some of our community elders, they may have different kinds of motivations. So for instance, they may want to keep up with friends and family. They're perhaps a caregiver for a loved one, and they need to stay current on a health condition or topic. They want to stay healthy and active, and they're worried about the health of their friends and loved ones. Some of the considerations here may be their familiarity with technology or social media, and then also any kind of what that process is for them to search for information that's credible and reliable. Community groups, they are motivated and concerned with creating safe and healthy communities for all. They may have a specific topic or function. They're focused on local issues, but tend to keep abreast of national trends. Most of these people in the considerations have an active social network. They're familiar with technology, and then they use the technology in order to stay connected with individuals in the community. Likewise, our clinical researchers, we can see the interests here and the considerations, again, thinking about their job priorities and some of the pressures from a professional standpoint about recruiting patients for studies, or the kind of time that they're spending in the clinic helping to care for patients, and balancing that with the need to stay up on the latest advancements in the field. They're usually very familiar with technology and fairly well connected because of the work environment. You can see here that they take advantage of a number of different kinds of sources of information. Healthcare providers obviously are concerned with caring for patients and their families and caregivers. They want to stay up on the latest advancements so that they can incorporate that into best practice research, or best practice care, I'm sorry. And consideration is that there, some of the considerations that we can keep in mind. They use technology for work and personal life, and which often I think may help to balance some of the challenges with the long hours that many of them work. They're very interested in evidence-based information, and they follow a few different kinds of resources and are overwhelmed with volume of email. And I know that that resonates with many of us on the call today. Individuals who are professionals in the environment, again, thinking about how they're incorporating technology and also some of the things that they're faced with, either from a professional standpoint or from a personal standpoint as they're working and caring for friends and loved ones who may have health conditions. And then we also have our funding agency. So the motivations for the funder is a bit different, although certainly similar. So they're very interested in advancing goals and priorities of an institute or agency. They have target audiences that the work is meant to benefit. They're very interested in promoting effective and efficient work processes and helping to maintain these efficient workflows to be able to do the best they can with the funds that are available. They tend to try and keep a broad view of people who are involved in research, so other kinds of government agencies, nonprofits, and others who have something to say or something to contribute or benefit from with the health agenda. And then some of the considerations we see in some of the other individuals, but we can see how they're using social media to interact with large groups of followers, and also that they are motivated to make the results of the research openly available to individuals who can use it. So we love that open strategy for sure. So speaking of open access and openness, I just want to put a plug in for publishing. So sometimes when we think about the work that we're doing, the first thing that we immediately think about is that peer-reviewed research. Very important. The best thing that I can do is to suggest, if for individuals who are thinking about publishing their research, is to work with your, the individuals in your organization who can advise on journal selection and practices. But I do want to suggest that open access publishing is an important strategy in terms of dissemination. Open access publications are free and open to read to anybody. So that means that your findings can be picked up by somebody who may not actually subscribe to a journal, for instance, and especially in these challenging economic times, that will increasingly become the case. Open access publications because of this, receive higher visibility. They generate more citations, and they also allow authors to maintain their copyright so that you can do what you'd like to with the paper. You can use it in your courses, you can post it on your website, so there's a lot of great things that you can retain here. Some suggestions of open access journals are shown here at the bottom of the slide. And then there are a couple of tools that individuals can use in order to say, like, okay, there's a lot of open access journals. Which one do I pick? You can, there's a tool called Jane, which is a journal name Estimator, I believe is the name of it. And you can like pop in an abstract and it'll say, oh, here are some journals that publish work like yours. And there are other tools like that as well. So just Google finding an open access journal tool, you know, and it will show you if it will bring back a few results. So let's imagine that you published an open access journal, or you published your paper, but you didn't publish it in an open access journal. That's okay. Like, we make decisions for lots of different reasons. And so I'm not going to suggest that there's only one way to do this. There are lots of ways to do this. And I'm excited because there are different ways that you can get your research out there. So let's say you publish in a closed title. Okay, what do you do now? There are a couple of things you can do. You can upload a version, the pre-formatted version of your manuscript to a digital repository. So you'll need to reach out to the journal to ask them if that's something you can do. There are often very specific guidelines from the journal about which version of the publication can be uploaded. So you'll want to work with the publisher on that. That's not a problem. They're used to having these discussions, so I wholeheartedly encourage you to do so. And then they will also be able to give you other kinds of guidance in terms of like how long you need to wait before you can make that publication open, if there's any kind of visibility restrictions, and then also licenses for that work. And you can actually look for publishing agreements yourself. I would recommend probably the easiest thing, and what I do is I go to the publisher's website and just look for copyright or licenses and see what I can find. You can also look up the titles in Sherpa Romeo in order to understand publishers' copyright and archiving policies. Okay, and here's what we talked about here, where we look up, this journal is topics in stroke rehabilitation. We look it up in the database, and we can see that an author can archive a preprint. The author can archive a postprint, so that's after it's gone through peer review. And we have the draft that's not like in that really beautiful final formatted version, but all of the really good science is still there. And then they also suggest that you cannot archive the publisher's version or the PDF. So that's that really beautiful final formatted version. So there are so many nuances, but tools like this really help to make it easy to know, okay, like what can I do? So that's what that would look like if you looked up the journal. So you may look to your institution or your organization to see if they have a repository that you can use to deposit that work. But not everybody has a digital repository, and that's okay. So there are a number of open resources that are available. There's Figshare, Dryad, and Zenodo. I personally would suggest, I use Zenodo all the time, and it's very straightforward and very user-friendly. And I know that a number of organizations are also using Dryad and Figshare as well. So, so certainly do take a look at those and see what you think. But my suggestion for someone just starting out here would be to take a look at Zenodo. Okay, so, you know, we've talked a little bit about publishing. So those articles in terms of disseminating the work, but it can actually happen beyond just that peer-reviewed literature. There are online strategies that we can see here. There are in-person strategies where, you know, like what we're doing today, we're talking face-to-face, albeit virtually, that we can share ideas. And then there are also different print strategies in addition to those peer-reviewed publications. I also want to encourage us to think broadly about what a research output is. It is that peer-reviewed publication. That's super important in many different respects for promotion and for communication of ideas and so on. So I definitely don't want to take away from that importance, but I also want to ask the question, your statement, yes, and. So yes, that is important. And there are a number of other things that are created during the research process, which are really important to capture and which also can be deposited into these repositories and can be shared and can be really critical vehicles to help to communicate information. And so here we can see a few of them, things like visually engaging graphics, patient handouts or teaching materials, the slides that you're presenting at a conference, guidelines, and so on. And so there are a number of different ways to think about this. So let's talk a little bit about enhancing dissemination. So we're thinking today talk a little bit about leveraging social media, and everybody knows that social media is everywhere. So we're going to go through a few of these and just kind of highlight some, show some highlights, and of course we can talk about it a little bit later in the question and answer period as well. Earlier I mentioned something about one of the things to keep in mind is generating content. Do you have content available? So there are some little snippets that can be easy for content. So like an interesting quote from the article, or if you have slides or so on. You should plan to have both real-time and evergreen content. And so what I mean by that is real-time is like for instance, ChicagoCHEC got the word out about our time here together today. You know, this is for a real event. It's limited on time, it's a presentation, or it might be another good example of real-time content are coronavirus positive case numbers. They are changing over time. And so, you know, something that is kind of very current now. Evergreen content stays relevant for much longer. So, you know, this is things like reviews or perspectives, lists, if you do a video or something like that. There are a number of topics that you want to consider for that content. So of course, discussions about the research findings, if individuals give quotes about your work. So let's say someone says, wow, I found this to be a really easy to read paper, and I was not aware that you know, this thing happens, then that's actually a quote that you could include in some kind of communication on social media. I'm a big fan of thinking about the next step. So here's this bit of knowledge that we've discovered, that we understand better now, the way that this system works. So what? So how does it relate to the community? How does it relate to the work in that field? How does it relate to policy or legislation that might be going through? And so helping people to connect those dots so that they can see the direct connection between the research that you and your colleagues are doing, and also kind of those bigger changes or those bigger opportunities to impact health, I think is really important. So lay summaries are a brief summary about the research that is communicated in more simple, easy to read language, plain language. And as you begin to think about lay summaries, personally, I think they're a very important part of research. I actually think that every research project should have a lay summary. Lay summaries are required for grant submissions in many cases. And what they do is they really take the question up out of the technical jargon and communicate it in a way that it is easier for everyone to be able to understand why that work is important. So these two questions are important to ask. What is it about and why is it important? And that helps to guide someone through working through this plain language or developing content for these lay summaries. So I've used the word plain language. Plain language is a synonym for clear communication. So that means your audience gets it the first time they read it or hear it. It's focused only on what they need to know, not about all of the other stuff that we tend to communicate in science. And it's written in a way that incorporates, it's very jargon-free, and it communicates in terms, techniques, and concepts that everyone can relate to. And there are a couple of resources here that can help with plain language. I will say even individuals who have very technical roles during their day-to-day work really appreciate plain language summaries, those lay summaries, because when we are trying to absorb knowledge because we are a caregiver for a loved one who is suffering from a health issue, it can be a very stressful time. And so to be able to have these resources that make it easier for everybody to be able to understand, like, why is this important? What's the main point? Is really a gift for the reader. And so I wholeheartedly encourage all of us to incorporate those. I also mentioned using graphics. So consider creating a summary or an infographic or an illustration. So, you know, what is it? We can have like a pictorial or a visual summary of the main findings of the article. And there are some resources that are mentioned over on the left-hand side. And you may be asking yourself, why? Why would I take the time? I mean, because this is actually, it's going to take time. And, you know, there are so many other things competing for our attention and for our precious time that we have. Well, here's why. So one journal and a number of other journals have shown that this can be a highly impactful way of engaging audiences. For instance, in the Annals of Surgery, there was an article that found compared to those who only had tweets versus tweet communication on Twitter with a picture, they have 7-fold higher impressions, 8-fold higher retweets, and a 3-fold higher article visit on the publisher website. So that's getting people from social media out into your research. I also wanted to, you know, just talking about social media, just to highlight a couple of things to think about as you're considering some of these different tools. Again, the most important thing is to think about who the key audience is. And that will help to guide your selection of some of these tools. So we'll go through these quickly because there is a lot of text on these and we don't, you know, it's not helpful to discuss in detail, but we can maybe talk about them during the questions. So Facebook, here you can see how it is, what the key audience there is, and also what it's used for, connecting personally with friends, families, family members, and topics that we care about. We can see why it's good for research dissemination, how it helps to support engagement. The best time to post is not 11 o'clock at night on any of these, but there are highlight times for posting, as well as any kind of access or privacy issues that you want to be aware of, and then whether or not you're able to do advanced searching. So if you're looking for reputable, consumer-focused health information, how could you use that platform in order to find that? Again, Twitter, a little bit different. It has a different key audience. You can think a little bit about how you can use it in your research, as well as any kind of advanced searching that you might want to do there to find relevant content. Here's a really good example of someone who has posted their research using Twitter. You can see it's written in actually really friendly language. So I just posted on bioRxiv preprint describing one of the wackiest discoveries of my time in science. Like, that's got my attention right away. And then we can see what that discovery is, and there's a link out to this scientist's preprint. As you're thinking about constructing tweets about your research, there are ways that you can kind of optimize them. So to include, for instance, we have Elizabeth Witt was quoted in this tweet. We may want to include her username so that she can retweet it. We may want to include the name of the organization, who the tweet is about. And then these hashtags also help us to drive attention to particular projects or particular topic areas. And they're often used for searching on Twitter. We also have those kinds of specific understandings around LinkedIn. LinkedIn has a really wonderful way of thinking about dissemination from the perspective of of a really nice visual interface, which is nice. Instagram, whole different target audience, but that's okay. That's really good, actually, because you may be trying to reach a certain demographic age population, or you may want to share images or videos through that mechanism. Again, YouTube, a great way to share video content, as I think we all know. And I just want to encourage folks to think a little bit about generating content through blogs, podcasts, and videos. I just had a paper come out last month, and we wrote a blog post about it just to get people taking a look at it and considering the concepts. And then we also planted a flag too, because we said, here are the 10 things that we want to do in this topic, and we want other people to work with us on this, so join us. And it got a lot of attention, and it was a great way to meet new people too. So I wholeheartedly encourage us to think about it, and there's a couple of resources here. So I'm not going to go through all of these. I've kind of talked a little bit about all of this today, but just to suggest that there's a paper that came out this year, and it's 10 simple rules for innovative dissemination of research. And it talks about all of these things in really practical terms with lots of good ideas, which is really wonderful. So I will close just with this idea about research impact. There's so much pressure about research impact, but hopefully what we've talked about today, we can understand that impact can be in a lot of different things. Beauty is in the eye of the beholder. And, we are more than some of these numbers that we think about, like my H index, or how many times have I been cited, or what journals am I writing in? It's like, am I actually connecting to the audiences that I really want to see my work, and I want to hear what they're thinking about, and do they have input, and do they want to participate? Can we partner somehow? And so, I think that's the main message here, is to think kind of holistically about all of this. And if we do have to think about numbers and metrics, which sometimes we do, to think about putting things into context. So there are some suggestions for some normalized citation metrics here. So don't compare. It's apples and oranges across different kinds of journals. And so be aware of that, and think about ways that you might be able to understand your relative attention or citations compared to other articles like yours. And then last, I'll just give a shout out for this metrics toolkit. This is a super easy, really helpful resource that can help you as you're thinking about some of these things and engaging on social media and so on, to understand, is what you're doing useful? So that's at metrics-toolkit.org. It's very graphical, very point and clicky, so it's easy to use. And then last, thanks to our terrific team at the library. These beautiful slides are all thanks to Karen and Patty. Karen's the head of the Research Assessment and Communications Department here at Galter Library. But of course, the library team is great, and a lot of their discussions and work has gone into this presentation. So with that, I will close and open it up for questions.
Thank you so much. What a wonderful and very informative presentation. Everyone has the ability to unmute themselves now and ask any questions that they have. One of the questions that kept coming up is, will the slides be shared? Slides will be shared to all who registered and attended. We'll send out an email today or tomorrow, and we'll be sending that information. And also, this is recorded and it will be posted on our YouTube page and ChicagoCHEC YouTube. And we'll also have access, everyone will also have access, a link will be sent in an email. I don't know if anyone has any current questions. Please feel free to unmute yourself and ask.
Hi, this is Jamie Shrieky at the University of Illinois, Chicago. Thanks very much for that presentation.
Hi, Jamie.
Hi, really enjoyed it. So I put this in the chat room, but I'll ask it. So one of the challenges that we find, at least in the School of Public Health at UIC, is different perspectives on open access publishing in our promotion and tenure committees. And I'm also on our campus-wide promotion and tenure committee. So there's a lot of debate about sort of the legitimacy of different open access journals. And, I really appreciate sort of the wide range of resources that you presented today, but I wondered if you could speak a little bit about sort of, things also to be aware of, and really knowing when, and probably most people on this call, like myself, get probably about 10 to 15 requests every day to submit papers to new random journals that have suddenly started, that are all open access. And, you and I are both senior faculty, but I think in particular for junior faculty, this may be a challenge navigating. So any suggestions you have for understanding and knowing when it's a legitimate open access journal versus maybe not so much?
Sure. No, that's a great question, and actually super timely, because even just this morning, we got a question about this. It's like, I'm concerned about for-profit publishers. And, it's like, well, they're all for-profit. I mean, but there's a difference between, I think there's this whole gradation from predatory publishers to, some of the titles that I mentioned earlier that are, have been like eLife and some of these new titles. I would recommend going to, there's a database of open access journals, and there's a link to that in the slides. That's a really good place to go and see open journals and reputable journals. Those emails that everybody's getting suggesting that you submit papers, they can be pretty tempting. Sometimes they're written in a way where you're like, oh, I don't think this is real. But sometimes they're written, especially if you've got to write a paper, like you've got a certain, like I've only written one paper this year, I've got to get something out. It can feel very attractive, right? And so what I would recommend is that the best thing that you can do is to be aware of your field. So understanding the titles that people are publishing in, what are you reading? Where are your colleagues publishing their work? That can usually be a very good way to get started, to kind of dip your toe into this space and to identify reputable titles that, that are accepted in your community. The other thing that I would suggest is that you do consider submitting articles in, working with the publisher to identify what you can deposit into an institutional repository or one of those generalist repositories that I mentioned earlier. So that way you can still deposit all of the great science, and you can still have the publication in a title that may not be as open. It creates a way to open the door, so to speak. But I guess I could commiserate about this all afternoon because it's very challenging. There are, if you look at some of our most widely used indexes of the scientific literature, which would be Web of Science and Scopus, each one indexes 25,000 titles. And there's a lot of overlap, but as you can imagine, it's, those are all very reputable. So if you go into one of these resources, PubMed especially, PubMed indexes maybe 6,000 titles. So if the journal is indexed by PubMed, Web of Science, or Scopus, I think it's fine. And that can also be a good place to go to get ideas of other titles that you might consider for a submission. I don't know if that answered your question, but I could definitely complain about it all day long.
Me too, thanks. But I just thought it'd be helpful for others to hear sort of your suggestions on it, so thank you.
Yeah, no problem, thank you. Any other questions?
Thanks. Hi, can you hear me?
Yes.
Thanks, Christy. Hi, Rubio speaking here from ChicagoCHEC team. Very great presentation. I actually love the way you took all the way back to the 1600s and it really puts in perspective where we're at today. I had a question about how does one go about becoming a reviewer in various journals? Related to the previous question, I was reached out from one of these, maybe not so legitimate journals, open access, that are asking me to be a reviewer, but how does one go about becoming a reviewer for a more legitimate, more impactful journal?
Sure. So I believe in some journals there are ways that you can submit your name. So if you are reading, if you're find yourself reading a lot of a particular journal, you can reach out to the journal, either see if they've got a way to submit your name for consideration to serve as a reviewer, or you might consider reaching out to one of the editor or an associate editor and saying, hey, I'm working in this field. Here's my background, and I'd really be interested in contributing this way. But I would also say the best way to get your to kind of get your name out there is to publish in those journals, and then they kind of tend to pull people who are publishing in those journals for reviewing articles. And one thing I review for a very wide range of journals, and some of them are not necessarily in my topic area, but I've reviewed papers for them that are in my topic area, like for instance, around research impact or, promotion or different kinds of topics like that. So I would just be open-minded about it, I guess, is the best way to kind of pull that together.
Thank you. Any more questions? We do have a few minutes, or about 3 minutes.
Yeah, I have a question. I kind of wanted just a little bit more explanation. You mentioned layman's terms in terms of when disseminating information to people that, general audience that may not necessarily have the medical terminology down. how would you know, an abstractor, you know, academic, you know, research abstract be put in terms, you know, for someone to understand who is not really familiar with medical terminology?
Sure, that's a great question. So, you know, as Beverly said, these slides will be shared, and so these resources will be available. But there are some really wonderful resources to help us understand, you know, kind of best practices around generating lay summaries. So that there's an article here, a spotlight on explaining your work in plain language, which is a nice blog post to kind of walk through that process, as well as some of the resources to assist with identifying plain language. One thing that I've done too that is related is I've actually looked, when I write a summary of research, I will go in and look at the grade. You know, sometimes word processing programs can allow you to like look at the kind of, I can't remember the term that they use for it, but it's kind of like it's written at what grade level. And that's not like a real assessment. It's just, you know, kind of the out of the box word processing software, but it can help you understand, like, am I writing in a way that is friendly and approachable for everybody? This is really important. This is an important skill, and it feels like it should be easy, but it's actually can be quite challenging. But it will really pay off in terms of both communicating your work in, you know, to communities of interest, but also even in the peer-reviewed literature or in writing grant proposals. I feel it's very important to incorporate that more straightforward sentence structure to not overcomplicate things. I think it's a good skill to have in general. So, but yeah, we'll make sure that you get these resources so that you can take a look at them. But I would also look, you know, do a Google search. You may find some strategies for writing lay summaries, and there's quite a number of really wonderful resources out there.
Okay, thank you so much. I think we've come to the hour. I will be sharing, like I mentioned, I'll be sharing the slides, and also, if it's okay, you can send any questions you have to ChicagoCHEC, and then we'll pass it on to Dr. Holmes. Thank you so much, Dr. Holmes, for the wonderful presentation and, you know, presenting to us this afternoon. Thank you everyone that joined us today to spend this 1 hour with us. Thank you so much for your time, and we'll definitely be sharing more information about our events, and you could follow us on our various social media pages. Thank you. Take care. Have a good one, everyone.
Thanks, everybody.
Bye. Take care. Bye.